The idea of APS is to promote multidisciplinary pain management. And I think the CCOE award is truly an award given by our peers. Multidisciplinary pain centers need to be able to share the best of their practices, and that's really what the awards program is about.
Our treatment philosophy at Brigham and Women's is all pain is real pain, and the patient is accepted for how they initially present. And we therefore base a care plan on their initial presentation. If we prove to be mistaken, we'll then adjust the care plan accordingly.
The toughest challenge I have, both as a clinician and a director, is what works today probably won't work in the future. And so I've got to continue to, innovate and try to stay ahead of the curve of what's happening in our state as well as throughout the country. And that certainly means adopting new care delivery systems, looking at different patient groups and trying to design more cost-effective care, and then also proving that our therapies work and that the way we approach a patient is cost-effective and helpful for the patient in the long run.
It's certainly an honor and a privilege that the American Pain Society has selected us again for the Clinical Centers of Excellence Award. And we're very proud that we've accomplished so much that we've received that award. But on the other hand, the award represents an ideal that we need to strive to keep attaining and keep achieving. And so what the award means to me personally is to keep on going, keep on trying, and keep on aiming for that elusive goal of excellence in everything that we do.
We practice multidisciplinary pain management at our center by having different providers under one single roof. We take care of the physical aspect by having a physician. We do interventions, we do medication management. We have the physical therapy rehabilitation part taken care of by having a physical therapist. We also take care of the psychological aspect by having a psychologist and biofeedback done in our center. And we also provide services with alternative medicine by having an acupuncture physician.
At our center, we practice interdisciplinary medicine using the biopsychosocial model. And whereas we treat the patient physically, psychologically, and in a social environment, so we take into consideration all aspects of his life.
When we originally opened, there were doubters out there that thought that we wouldn't make it. There were people that believed that we'd be out of business pretty soon. And I think the traditional thought of pain management is that if you want to do an integrative program, if you want to do a comprehensive program, you have to do it in an affiliated way because you have to deal with some losses. And I think that most pain practitioners follow the route of not having that type of program, being solo practitioners. So there was a lot of skepticism involved. When we built the program, we had Dr. Diaz-Ramirez, who's our medical director, and she had worked on several design of different centers before, so she brought that expertise into building this program in a way that was truly sustainable. And we've proven that we can do it successfully, and we've won the accolades of the American Pain Society to validate that we are doing the right things, and we're doing them in a way that's still profitable.
One of the things that distinguishes our program, which is truly multidisciplinary, is that we view chronic pain problems in the context of the entire family, the entire social stratum that the youngster lives in, and the way we bring it to bear sort of at the front lines with our patients is we've developed our program so that truly we integrate mental health with medical care in one setting in a very efficient, very unified way.
I'm thrilled to say that we have many projects going on right now. One of my favorite areas of research is to combine yoga with yoga as a treatment for youth who are both obese and have co-occurring pain problems. We just completed a study where we obtained very positive results, and the participants were quite happy with the results themselves.
Whenever you're working with children who have chronic pain, you need to step back and look at the big picture. And I think that our fundamental underlying philosophy that drives our clinical care and our program is really looking at that big picture. What are the ramifications of youngsters having pain? What are the ramifications of their medical illnesses that they have? Are many of their pain problems being driven by various psychological cofactors that play a role in how they interpret their pain and then lead them in a lot of ways to become functionally disabled? So our program is set up in a way that really looks at all of those cofactors and tries to address them both from the medical side and the mental health side from the get-go.
Multidisciplinary pain care at our center involves a team approach of rehabilitation physicians, psychologists, vocational rehabilitation counselors, physical therapists, and occupational therapists. And it's all about helping patients improve their function, to get them moving and healthy and active and overcoming their fears.
We're a structured pain program, and what that means is that it's an all-day program. We always start with rounds. All team members are there, the vocational counselors, PT, OT, psych, and the physician. And then there's a pretty structured schedule. Patients know what their schedule is, they're on a particular team, so their physician, their psychologist, and their therapists don't change. Within that structure, there's a lot of variability. If people need to see the physician or see the vocational counselor, they can. We're in one building, and it's basically one floor, so all the team members are pretty accessible.
The treatment philosophy of our center is primarily a rehabilitation approach. The goal is to help every patient improve their functioning in a variety of different areas: physical functioning, emotional functioning, social functioning, vocational functioning, and recreational functioning. And we use cognitive behavioral strategies, but much of it is a rehabilitation process of gradually helping patients confront their fears, move more, and return to as many normal levels of activity as possible.
New Mexico is a very rural state, and so because it is not only rural but very large, it is difficult for patients to access, especially specialty care. And so by utilizing technology, Project Echo is able to deliver that care essentially by eliminating geography.
Very regular are participants from many parts of the state. We have a physician assistant from Española who works in a large multi-center family practice, federally qualified healthcare network. She has become really the pain expert in northern New Mexico, and she receives pain consultations now from her colleagues. She sees the patients, and then she's able to send the patients back to them, and then they learn how to take care of patients.
Since it is a provider-to-provider consultation service, we are able to have a larger impact on the number of people that benefit from what we do. Because by teaching those providers and by providing consultation to them, they in turn are not only just treating a single patient, of course, but all the patients that they see. Winning this award in terms of our organization is really validating in that an innovative approach to the delivery of healthcare is being recognized as important.